Alright guys, so hopefully this is going to be my last video on this chapter. So I'm again on chapter 33, obstetrics and prenatal care. And in this video, I'm going to be just running through really quickly and just showing you some places that I'd like for you to draw your attention. So just like with every other chapter, it starts off talking about anatomy, being able to identify an embryo versus a fetus, and the birth canal, the cervix. As you turn the page, it talks about the perineum and the placenta, and then the umbilical cord. And I actually highlighted this section right here talking about the amniotic sac. And I believe that I was most interested in the amount of fluid that it contains, which it says right here in your book, 500 to 1,000 milliliters. And that helps to protect and insulate the baby. Let's see. As we go on, it starts talking about those complications in pregnancy on 1186 and gestational diabetes. I bet most people are familiar with that with pregnancy. This is just a diabetic symptoms that come on as part of the pregnancy itself. It doesn't happen with every pregnancy, and it doesn't happen with every patient, but it could develop. And once the baby is delivered and the pregnancy is over, the patient should normally go back to a regular lifestyle. But this is used with good prenatal care. This is caught early in the pregnancy, and they're able to help that along and make sure the developing fetus it grows properly. All right, so as we go on 1187, this is that area where I made those other 3 or 4 videos, so I'm not going to spend much time there. Let's see. I hung out right here where it was talking about cultural value considerations. Just keeping in mind that not every culture is like ours, and even if they do have a culture that's similar to ours, you need to make sure that you offer the patient as much privacy and retain her dignity as much as you can. It goes on as far as the patient assessment portion of this chapter, starting with the scene size up to the primary assessment, history taking, secondary assessment, and reassessment. And in the next part, let's see, I did highlight this right here where it's talking about the meconium stain. Now this is on page 1192, and a meconium stain is when the fetus is delivered and they actually have had a bowel movement during the childbirth process. It's usually an indication that there was a pretty good amount of stress during delivery. You need to suction the baby as soon as it's delivered to make sure you clear that out of their air passages. It's not a situation that, if you manage it properly, it's not that horrible of a situation. You just need to protect their airway and get that out. If you don't, it could cause infection and pneumonia. I will say on 1193 right here, stages of labor, you need to pay attention to this. You need to be able to identify the stages of labor and what marks the next stage in labor, okay? So there are 3 stages. Talks about it right there in your book. I'm not going to bore you by reading that. You can do that, but pay attention to that. Be able to look at a test question, giving a sequence of events, and be able to say that, okay, that's stage 1 or that is stage 2 in pregnancy. Turning on, let's see. Know the difference in prima gravida and multigravida. That has to do with if this is the first pregnancy or the person has had multiple pregnancies. And then it goes into preparing for delivery, okay? Starting on page 1194, and it takes up a couple of pages here. Talks about the OB kit. I think I may even make another video just showing you what's in OB kit, but that is basically the contents of it. And there's a list of items right here that could be found in an OB kit, okay? That's on page 1195. All right, we're turning the page, talking about patient positioning and preparing for delivery. Some pictures right there. We're just going to scoot on through those. And then this skill drill right here, I don't know how they expect you to do this other than just read through the skill drill. Because a lot of the skill drills in the book, they actually want you to do this, and we just don't have that many pregnant females available to us for everyone to deliver a baby. So I would just tell you to read the captions underneath. The pictures would be the best thing for you. All right, so then it goes into delivering the head, and then some complications that may arise during the actual birthing process. One of them being nuchal cord. I actually highlighted that one. And let's see, I highlighted on 1202 talking about the fundus. And then it goes into neonatal resuscitation. Now this part here, I'm on 1205, and I want you to pay attention to table 33-4. That's the APGAR scoring system. And we do actually use this, and they use this under normal deliveries at the hospital. So it's a way of gauging how well the newborn is doing. It's performed once at 1 minute, and then it's performed again at 5 minutes after birth. And so you can see that this is the chart here. Be familiar with this and how to calculate this. This could actually be a test question on registry as well as your unit test. Given a set of circumstances, what would be the APGAR score? So the categories there is their appearance, their pulse, their grimace or irritability, basically them crying, and then active activity or muscle tone, and then respiratory here. And then a good score would be a quality of 2. It talks you through what that would look like. And then an okay score would be 1, and then a 0 would be not very good at all. So it's not uncommon using the APGAR score at 1 minute for a baby to have and in fact it says it right here in the book, to have a score of a 7 or 8, and then at 5 minutes the score may improve right up here to about 8 or 10. So you could expect that to happen at 1. So, or at 1 minute, that the score may be a little bit lower than it would be later on at 5 minutes. I need to wrap this up here really quickly. This video is getting a little bit long. Complicated delivery emergencies. Read through all these. Read through all of this. Be familiar with this. The pictures are pretty good. As you can see, there are times when we need to intervene, and then there's other times when we would not intervene. So be able to identify those situations. That just about wraps up the chapter. Obviously you'll have an assignment for this chapter, and I think the most important thing to remember is with good prenatal care, when a mother goes into labor, that baby's coming, and there's nothing you can do to, let me flip it around here. There's nothing you can do to stop it. It's coming. I know a lot of people who were born. Myself, I was born, and I bet you were born. So this happens every day. It's nothing to panic about or get really excited about. And remember that if you get to deliver a child or a baby in the field, it is a great thing to do, and it is a happy time. Hopefully, this will be a normal delivery. It's not what the mother expected. She probably did not, as a young girl, imagine having a baby in the back of an ambulance. But yet here we are in this moment, and that's happening. So keep that in mind. Keep mom calm, and treat the baby. And this should be a happy time. But just be aware of the complications that could arise if they come. The take home on those complications are, number 1, treat for shock. Manage that airway, high flow to keep the baby or keep the mom warm, and later on her left side. That's going to be it for this chapter, and I will see you in the next chapter. Talk to you soon. Thanks.